Are pacifiers good or bad for your baby? The debate has been raging for years, and it's time to get to the bottom of it. In this video, we'll explore the pros and cons of using pacifiers and help you make an informed decision for your own child. So whether you're on the fence about pacifiers or just want to know more about the potential risks and benefits, keep watching. Hi there and welcome to Yardy Baby. If you're a parent or caregiver, you've probably heard both sides of the pacifier debate. Some say they're a lifesaver for calming fussy babies, while others claim they can cause problems with breastfeeding and dental development. So what's the truth? Keep watching to find out. First, let's talk about the pros of using pacifiers. Many parents and caregivers find that pacifiers can be a helpful tool for calming a fussy baby, especially during the first few months of life. They can also be helpful for babies who are going through the process of teething, as the sucking motion can provide some relief from the discomfort. However, it's important to consider the potential drawbacks as well. One concern is that pacifiers can interfere with breastfeeding. Babies need to latch on correctly to the breast in order to properly extract milk, and using a pacifier can sometimes cause them to develop a lazy latch. This can lead to problems with milk transfer and may cause the baby to be less satisfied after feedings. It's important to be aware of this potential issue and to try to limit pacifier use during feedings, especially in the early months when breastfeeding is being established. If you do notice that your baby is having trouble breastfeeding after using a pacifier, it may be worth trying to wean them off of it or using it only in certain situations. Another concern is that prolonged pacifier use can lead to dental problems, such as an overbite or misaligned teeth. It's important to monitor your child's pacifier use and consider weaning them off of it as they get older. Some experts recommend weaning off the pacifier around the age of 2, as this is the age when the permanent front teeth start to come in. If your child is still using a pacifier at this age, it's possible that it could affect the way their teeth come in and potentially lead to dental problems down the road. So what's the bottom line? Pacifiers can be a useful tool for calming a fussy baby, but it's important to consider the potential drawbacks and to use them in moderation. If you do decide to use a pacifier, be sure to properly sterilize it and replace it regularly. It's also a good idea to have a plan in place for weaning your child off of it as they get older to avoid any potential dental issues. Now, let's talk about some of the other arguments in the pacifier debate. Some people claim that pacifiers can increase the risk of ear infections, as the sucking motion can create a vacuum in the middle ear and potentially lead to fluid buildup. However, the evidence for this is somewhat mixed. Some studies have found an increased risk of ear infections in children who use pacifiers, while others have not. It's important to keep in mind that ear infections can be caused by a variety of factors, and pacifiers may not be the only contributing factor. If your child does have a history of ear infections, it's worth discussing with your pediatrician whether or not pacifier use could be a contributing factor and if it might be worth limiting or eliminating their use. Another argument against pacifiers is that they can cause dependency and make it harder for babies to self-soothe. While it's true that pacifiers can provide a sense of comfort and security for babies, it's important to remember that they are just a tool and should not be relied on as the sole means of calming a baby. It's important to teach your child healthy coping mechanisms and encourage them to find ways to self-soothe, such as through sucking on their thumb or using a security blanket. If your child becomes too reliant on a pacifier, it can be harder for them to fall asleep or calm down without it. This is especially true as they get older and may not always have access to a pacifier when they need it. It's a good idea to start weaning your child off of the pacifier before they become too dependent on it, and to teach them other ways to cope with stress and discomfort. On the other hand, some people argue that pacifiers can actually help babies learn to self-soothe and fall asleep on their own. The sucking motion of a pacifier can be calming and help babies to relax and fall asleep, which can be especially helpful for parents and caregivers who are trying to establish good sleep habits. However, it's important to remember that pacifiers should not be used as a replacement for good sleep hygiene practices, such as having a consistent bedtime routine and creating a calming sleep environment. So what's the best course of action for parents and caregivers who are trying to decide whether or not to use pacifiers? As with many parenting decisions, there isn't a one-size-fits-all answer. It's important to weigh the pros and cons and decide what's best for your individual child and family situation. If you do decide to use pacifiers, be sure to use them in moderation and have a plan in place for weaning your child off of them as they get older. It's also a good idea to keep an eye on your child's dental development and to consult with your pediatrician if you have any concerns. Thanks for watching. If you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for more baby-related tips every day. And if you have any thoughts or experiences on the pacifier debate, let us know in the comments below.